Hey, Dr. Tracy, board certified general pediatrician, and I wanted to talk about what are the reasons why the hepatitis B vaccination is recommended in the newborn period, and what are the risks versus benefits of giving it then versus waiting until later. So this has again become kind of a controversial subject that most of us in the medical community don't fully understand why, but I think it's good to ask questions, and I think it's good to get all the information so you have informed consent. And I'm going to give you a little bit of a brief overview. I'm going to give you some websites at the end where you can go get more specifics, but I feel like it's better to talk person to person. I think you can look up statistics all day long, and if you don't fully understand what it means, it makes it so much more confusing. So hepatitis B is a blood-borne virus that can cause chronic liver failure. It is usually spread by sexual intercourse and blood-borne products. So high risk would be IV drug users, sexually active, healthcare workers, blood donations, organ transplants, IV drug use. I mean, there's lots of different risk factors. So when the vaccination was first instituted and put out into the community, it was only given to high-risk individuals. And so doctors would screen people, and they had to admit that they had these risk factors. So what do you think happened? It didn't work. We have learned in public health, if you only give vaccinations to those that are high risk, you really don't make a dent in the community, which is the whole point, right? Is to get the herd immunity so that no one is getting hepatitis B. What they also noticed is that even when mothers tested for hepatitis B in the first trimester, 20 to 30% of positive babies for hepatitis B were born to hepatitis B negative mothers. And this was thousands of children a year in the United States. And so the opportunity arose to say, hey, we're already trying to prevent these babies from getting hepatitis B from their mothers, and we can't trust the test 100%. It's a good test, but again, a screening tool only has to be about 85% sensitive, meaning it can miss up to 15% of positive cases. So with a screening tool that's only 85% and you can't catch them later, it made so much more sense to give it to every newborn to make sure that no newborn got hepatitis B. We in public health do not believe that any child should get a preventable disease because the risk is too high. So the vaccine had already been out for several years. It had already been shown to be safe and effective. They'd already been giving it to newborns when the moms were positive for hepatitis B. So we had years of data to show that it was very safe and extremely effective at preventing hepatitis B in newborns as well as in high-risk adults. So when they instituted giving it to every newborn, the rates of hepatitis B to positive mothers is 0.07%. It is so low. So even if the mother is positive and you know it, you can decrease almost all transmission. But the moms that were negative, there's none. So those 20 to 30% of cases that were popping up in newborns, that doesn't happen anymore. So we saw this as a huge public health win, right? You get these babies, you prevent those few that are going to get it from their mothers, and then you know they're protected for the rest of their life. So regardless of what their risk factors are in their childhood, adult, later life, you know they're protected from a virus that can kill them. So public health saw this as a huge win. We've been doing it for well over 20 years. It has an extremely low rate of side effects, and it has been extremely effective. This is also given in most countries worldwide. Different ages, just depending on what's available. To be honest, when you read about other countries not having certain vaccinations, sometimes it has to do with what is available, not just what is safe versus not safe. So we see ourselves as leaders in healthcare in the United States, and we want to continue to be that way. So when I present this to families, when I have the opportunity to talk in a prenatal visit or when I was the newborn doctor in the hospital, that is the way that I like to present it, is that I recognize you've had a negative test and you may feel like you know all of your risk factors. I thought I knew mine, right? But still, I did not take that chance with my own kids because I knew the vaccination was safe. I wanted them to have it at some point. I would not have been able to live with myself if I was someone who tested negative and was really positive and gave it to my kids. Therefore, I gave it to both of my children, did not think twice about it. I recommend it to all babies. What do I do when families decline it? That's their choice, right? I do understand. I understand the concern. The evidence does not support it, but again, I understand parents feeling a little bit cautious because these are newborns. So we try to give them the best information that we can, try to share with them the data. It's very safe, it's extremely effective. It's so effective that here's the last point. You've got the newborn period, right? Where you cannot guarantee that you cannot give it to your baby, even if you've been negative. The other part to that is when hepatitis B transmission rates became so low in the United States, what did we talk about? Vaccines are a victim of their own success. All of a sudden, they stopped screening as high for it with blood transfusions. And so you used to have all of these restrictions to donate blood. Because they needed blood more than the risk of hepatitis B, they started accepting more high-risk individuals to donate blood. And they did that because they assumed that everybody was vaccinated for hepatitis B. And so as transmission rates drop, there is the potential to see if a baby needs a blood transfusion for any reason, that there could be a slight increased risk of getting hepatitis B even from a blood transfusion. And so it just further helped us feel more confident that catching them in the newborn period would help prevent any transmission rate of hepatitis B throughout their life, regardless of their risk factors. So I hope this helps a little bit, give you a general overview, help you understand from as easiest as I can explain it, why it is recommended, why we still think it's safe and effective, but also help open up the conversation with your provider so that you can ask about your specific situation. So please talk to your providers, talk to your OBs, have a meet and greet with your pediatrician or primary care provider. There's 2 websites that I recommend. There's many more, but 2 easy ones are healthykids.org, as well as the Children's Hospital of Philadelphia has an excellent vaccine website. I'll link them both in the comments. I am going to block comments for this, as I do now with all of my vaccine posts. I just think it's better. There's plenty of platforms where people can put out their information that is against vaccinations. I just don't want it to be on my platform. I want this to be a safe place where people can get information, they can take with it what they want, and then go to their providers and ask questions. And so that's why the comments are blocked. It's just better for my mental health. I think it's better to not amplify voices that I think are already amplified enough on social media. So I hope this helps a little bit. Take care, and we'll do some more of these specific vaccination talks in the future. Bye.